My name is Ben Maxwell. I'm one of the consultant anaesthetists here at the Great Western, and part of my job is to help women to be comfortable in labour, partly by giving them epidurals. So I hope you'll watch this short video to talk about methods of pain relief in labour. Apart from anything else, we know that it's one of the ways, if you know more about pain relief in labour, that you're less likely to suffer as much pain. So it's important. We'll also have given you a leaflet, I hope, early in your labour about pain relief. If English isn't your first language, it's available in different languages, and it's extremely good. If you haven't got one, please do ask a midwife. Labour pain is really variable. Giving birth is painful, but the experience is very different for different people. No two births are the same, and while for some people it's really extremely painful, for others it's a pain like a period pain, and in retrospect that's what they say. The reason that you get pain is partly that the structures need to stretch for the baby to come out, and partly it's the muscles hurting just because you're exercising them very hard. So labour pain is normal. People's attitude, mothers' attitude towards it varies. Some people say, well, that's normal, that's natural, and I want it, and I'm going to cope with it. And other people say, that isn't necessary in this day and age. And of course it's not necessary. And there are a variety of methods of pain relief available, and I want you to know about them. It's not that you have to have one and then the next and then the next. It's a variety, a menu of things that we can provide and you can choose from. It's your body, it's your choice. We'll do our best to advise you, but we all want to make your labour and your childbirth as safe and as happy as it can be. So there's a variety of methods you can choose from. So if first of all we cover those which are really methods of coping well with the pain. So this is things like having someone with you who knows you and who's there for you. It might be your partner, it might be a birth companion. It's extremely helpful, and we know that it reduces the amount of pain that you get. You're less frightened, and not surprisingly it helps. Anything that will help you relax may be helpful. So music may be very helpful. Getting your partner to massage you may be very helpful. There are particular massage techniques your midwife may be able to help you to learn. There are techniques of breathing that people learn, and some people find those very helpful. So overall, 90% of people find some of these methods, use some of these methods and find them helpful. Some of the other things that are natural or holistic aren't proven, and those are things like aromatherapy, sorts of acupuncture, and sorts of hypnosis. And we've nothing against you using those at all, but if so, those are things that we'd ask you to bring, and we will support you and help you with. Another thing we know is helpful, and again natural, is to be in water during your labour. This isn't necessarily a water birth, but we know that being in water seems to be very helpful. This isn't a hot bath, it's a relatively warm bath. It's not suitable for everyone, but it can be really helpful. Moving on to the more medical things, something else I'd like to cover is a machine called TENS. It's a nerve stimulator that you strap on your back. It has sticky pads that you put on your back. It's something that we don't provide. If you want it, you have to borrow it. It's a machine that, in a sense, is distracting. It provides a very low electric current, sort of tingly feeling in your back, and that reduces pain. It can be really helpful at the end of pregnancy with things like backache, but its role in labour is less certain. Only about 5% of people use it. And while about a quarter of people find it very good, again, a quarter of people say it was no help at all. It's suitable for most people, but not if you have epilepsy or if you have metalwork in your back from previous surgery. Moving on now to more drug-related things, the mainstay probably is Entonox. That is gas and air, laughing gas and oxygen. And you can breathe that in during your labour. It's used by the majority of women in Britain, and 85% say that it's very helpful. It's a really strong painkiller, and while pain in labour is rather different from other sorts of pain, from surgical pain for instance, it's very helpful, for instance, if people break bones, but it's an example of something that works well for both. It's something you breathe in. If you stop breathing it in, it's all gone in 2 minutes. It's just like you didn't have it at all. So if you don't like it, if you don't get on with it, that's fine, just stop using it. But it does make you feel, as well as taking away the pain, it does make you feel quite woozy, and it can make some people feel unacceptably out of control, and about 10% of people feel sick. So the vast majority of people find it helpful, but if you find that it causes those things, you stop breathing it, it's all gone. If gas and air, if Entonox isn't enough pain relief for you, it's then difficult to know what to recommend. One possibility is to have an injection of pethidine, a strong painkiller under other circumstances. The good news is that it's very quick and easy to get. You tell your midwife you'd like it, the midwife agrees, and she goes and finds another midwife. They give you an injection in the leg, and what effect it has, it has. The bad news is that during labour it doesn't necessarily work very well for a painkiller. It makes you feel somewhat sleepy, and that can be really useful and relaxing, but it does sometimes cause people to feel sick. The other thing is that it can make your baby somewhat sleepy when the baby's born, and although nobody suggests they don't go to university as a result, it may make, for instance, starting breastfeeding more difficult. About 20% of people use pethidine, and of those, about 60%, about 6 women in 10, reported as helpful. So that's one possibility. It's simple, it's easy, but it's not necessarily what you want. So the other possibility is to have an epidural. And an epidural is getting more medical, but the good news is it's something really very effective. They're used by only about 30% of people, but 90% of women who use them say that they were helpful, and 85% said they'd be happy to have an epidural next time. So it's a really helpful thing. If you have an epidural, it needs a specialist doctor to put it in, so it's not available in midwifery units. And what's more, if you want an epidural, even if you agree with your midwife and there's no reason that you can't have one, it may still take a long time for the anaesthetist to arrive. It'll usually take half an hour, but it might take quite a lot longer than that. But half an hour for the anaesthetist to arrive, quarter of an hour to put the epidural in, and at least quarter of an hour to get it going. So you can see that there's some forward planning about when it's going to be painful, or you're going to be in pain for some time. When we put in the epidural, we do use local anaesthetic, and although people worry that having an injection into their back, because that's what it means putting an injection into your back and leaving a fine plastic tube there, although that sounds painful, for most women the experience is not terribly painful, and the reason is that we use local anaesthetic. If you do choose to have one, if you have one, if it turns out to be painful, tell the anaesthetist. They can easily put in more local anaesthetic, and if you aren't finding it acceptable, they'll stop doing it if you ask them. Once you've had an epidural put in, it does mean your labour will be slightly longer, but that actually isn't a problem if you and your baby are comfortable, and generally that's the case. It does mean in this hospital that you will need to be on the bed. It may be that you've seen pictures in other hospitals of people walking after an epidural. At present, we don't advocate that. Partly that's because we need to keep a careful eye on you, because it can, for instance, cause your blood pressure to drop, and also we keep a close eye on your baby at that point, because people who need epidurals, there's a higher chance that their baby may be developing problems. They're having a long and painful labour. It doesn't mean the epidural is causing it, but it means that we know there's a higher chance that they are people that may be going to need a caesarean section. You will therefore need to be attached to various monitors. And you will find over time your legs become numb and floppy. There are other things, you might get the shakes and so on, but these are minor. There are some things which can be serious, like being allergic to the drugs, but these are very rare events. It's the sort of thing that happens to someone in the United Kingdom maybe once every 2 or 3 years, and when you think someone wins the lottery twice a week, it puts it into perspective. If you need an epidural, we'll be there for you, and I hope you'll find it's very effective. And if you want an epidural, and by this stage you're already in a lot of pain and moving around a lot, people wonder how that's going to be possible. And one thing is that actually we can generally manage, but another thing is that there's a slightly different variety of injection we can give you in your back, called a spinal injection, which can make you initially very comfortable and give us time to sort out putting in an epidural for you. And under some circumstances we'd use that. So we've talked briefly about a variety of different pain relieving techniques. Some of them, things like finding out about it, knowing about what's coming, things like bringing a birth companion if you can, investigating massage, thinking of ways you can relax. I'm sure you should investigate. And the others, well, it may be that you're someone that wants to plan using them anyway. But even if you aren't, knowing that they're there, knowing that if you need them, we can provide them, will help you to have a happy and a safe childbirth.